Hello everyone. Unlike my other videos, this video is rather more specialized. Probably you are watching this video if you or your near and dear ones have been diagnosed with endometrial hyperplasia and watching for the next step of treatment. You have come to the right place. For the clarity of information, I would like to divide into three groups of women. Group A, who have been diagnosed to have endometrial hyperplasia on a biopsy and still has got their uterus inside. I will address you first. Then group B, women who have been diagnosed with endometrial hyperplasia after they had their uterus removal surgery or hysterectomy. If it is a simple hyperplasia or hyperplasia with atypia, then your treatment is likely complete. But you should discuss that with your gynecologist. You do not really have to watch this video. However, for general knowledge, you are welcome to watch and stay with us. Group C, I guess there could be a third group of women where the uterine endometrial hyperplasia has been diagnosed on ultrasound scan. Well, this cannot be diagnosed with certainty with an ultrasound scan because it's a microscope diagnosis. However, sometimes some reports mention this. If you just had ultrasound and not had any biopsies yet, you need at least a camera test inside the uterus called as hysteroscopy and get the inside lining of the uterus checked. Let's start. What is endometrial hyperplasia? Endometrial hyperplasia is too much of cell division inside the inside lining of the uterus, and the inside lining of endometrium is getting thicker. Why understanding of hyperplasia is so important? This is because this is a precancer stage before progressing into uterine cancer. Again, endometrial hyperplasia is divided into two different groups as evident under microscope. First is endometrial hyperplasia without atypia and another is atypical endometrial hyperplasia. What is endometrial hyperplasia? Atypical endometrial hyperplasia is more interesting. If we look deeper into the uterus, we will find in 50% cases, that is every second individual, have already developed endometrial cancer inside. It was not picked up by the biopsy, and this biopsy only picked up the endometrial hyperplasia with atypia. So atypical hyperplasia is something to watch out for on the biopsy report. How hidden cancer is missed then? I'm sure you are asking, if there is hidden cancer, why not this was not reported and atypia is only reported? Well, human body is complex. I'll show you a picture here. You can see when cancer develops inside the uterus, the whole uterus does not become cancerous all of a sudden. Instead, cancer starts at the corner or corners of the uterus and eventually it involves the whole of the uterus. Hence, even if the cancer has started within the uterus, some of the biopsy reports will be just normal or just show precancer as the sample was from the neighboring tissues of cancer and not from actual area of cancer. As a matter of fact, cancer is hiding somewhere else. While taking the biopsy, it is gold standard to watch inside the uterus as we take directed and targeted biopsy with hysteroscopy. Treatment. Anyway, if a precancer has been identified, what is the next step? Of course, the next logical step will be to remove the uterus, isn't it? This will completely stop the progression into cancer. And of course, if this is an early cancer, with the surgery, you will remove it. End of story. But diet, exercise and avoiding bad chemicals. However, there are some recent data which suggests that if we can remove the causative factor or factors which cause the extra cell division inside the lining of the uterus, in good number of cases, patients can avoid having a surgery. Uterus will get back to its normal endometrium. What causes endometrial hyperplasia? We need to know that first in order to take the precautionary measures. Moving forwards, let's address the next point. What causes endometrial hyperplasia? Mostly, it is a hormonal mismatch. Too much of estrogen. That means because of extra body weight, extra fat cells convert many chemicals into female hormone called estrogen. Too much of estrogen drives crazy cell divisions within the inside lining of the uterus. Uncontrolled cell division is precancer and cancer. Normally, cells division can be stopped and body can place a break, but in cancer that break fails and tumor develops. Losing weight through a proper diet and exercise can help normalize hyperplasia. Occasionally, we will find patients who take too much of plant-based estrogen containing diet such as soybean. Some might have taken too much of estrogen tablets in the body for hormone replacement therapy. In either of the cases, the body gets too much of estrogen. Estrogen talks to both uterus and breast. These organs are hormone sensitive. Estrogen can drive cancer in both of the organs. Sometimes extra estrogen may also come from some group of chemicals in our environment called EDC or endocrine disturbing chemicals. These could be pollutants from water or cosmetics, could be dairy products in unregulated countries and economies where chicken is still injected antibiotics and hormones for cheap meat. Could be cows who are injected estrogen to yield higher amount of cheap milk for bigger profit. A breast cancer treatment medicine, tamoxifen, can also cause endometrial hyperplasia. In this case, you must need to consult the breast surgeon doctor to check about tamoxifen. Well, if you can revert all those factors, then endometrial hyperplasia could be reverted. However, after 6 months, we must perform another biopsy to check if the endometrium has returned to its normalcy. If patient's diet, lifestyle modifications were successful, it would revert. Progesterone therapy. Some women will choose to have a progesterone hormone against hyperplasia. Progesterone is another female hormone and it protects the endometrium from developing into cancer and somehow counteracts the effects of estrogen. Here, the patients may choose to have oral progesterone tablets or local progesterone therapy directly inside the uterus. Oral progesterone will travel through the liver after we take it by mouth before going to the uterus and can damage liver. After 35 years of age, liver damage from hormones is higher. Hence, a clever approach is to give local progesterone inside the uterus directly. Here, the progesterone acts directly in the inside lining of the uterus and dials down the precancer endometrium into normalcy. Checking the result of treatment. Following 6 months of treatment, it is very important to verify if the endometrium have fully recovered. Otherwise, a more rigorous potential surgical approach may be necessary. This 6 months follow-up must be with a biopsy, not just by checking the amount of pattern or bleeding or just by doing ultrasound to check inside lining of the uterus. The 6 months follow-up has to be by biopsy. Because we must not forget that we are dealing with a precancer condition. With a little bit of push, it may develop cancer any day. This brings us to the surgical treatment of endometrial hyperplasia. This is by uterus removal surgery or hysterectomy. Generally, this is a hysterectomy. Depending on patient's age, the ovaries and fallopian tubes might also need to be removed along with the uterus. If someone has developed endometrial hyperplasia with atypia, then just lifestyle changes or getting progesterone might be more risky. Laparoscopy surgery. Patients with atypia needs to be offered to have uterus removal surgery. As in half of the cases with atypia, we will find uterus cancer has already developed within the uterus. Don't worry, in most of the cases, uterus removal can be done through a keyhole surgery called laparoscopy. Doctors will need to be vigilant to check if the cancer has already developed within the uterus, because in those cases, just hysterectomy may not be sufficient for the final treatment of the woman. To avoid a second major surgery beyond hysterectomy, rigorous planning is needed between the patient and doctor, just so that the patient can get the benefit of the scientific advances of modern gynecology. Endometrial cancer rates are rising rapidly throughout the world. Because of obesity, being overweight and pollution, the endometrial cancer rates are rising rapidly throughout the world. But fortunately, treatment is also improving significantly. In summary, endometrial hyperplasia is increasingly common. With proper treatment and planning, the patient can go home happy and potentially live happily ever after. That's all today.